This is to tell you about the Learning Disabilities Mortality Review, or LeDeR programme. The LeDeR programme is a big piece of work happening across England. The LeDeR programme is checking to make sure that when someone with learning disabilities dies, it wasn't preventable. That means that they got the right support, care, and treatment, and still their death could not be avoided. This work is happening because we know that in the past people with learning disabilities have died when it could have been prevented. We know this because in 2007, MenCap published a report called Death by Indifference. This told the story of 6 people who had a learning disability who should not have died. Death by indifference was followed by a confidential inquiry to look at why people with learning disabilities sometimes live shorter lives than other people. This inquiry is called the Confidential Inquiry into Premature Deaths of People with Learning Disabilities. A lot of people say CIPOLD for short. The inquiry found that on average people with a learning disability die 13 to 20 years younger than other people. They also found that some deaths could have been prevented if those people had access to the correct healthcare. The main reason that they did not access the correct healthcare was a delay or a problem with finding out what was wrong with them. One example of someone dying when they should not have is Connor Sparrowhawk, also known as Laughing Boy, an 18-year-old man with learning disabilities who drowned while bathing due to a seizure. This was preventable. If the medical professionals looking after him had accessed his medical history or responded to the knowledge that his family shared, he would not have been bathing without support. Already lots of work is happening to make things better following the CIPOLD. The LeDeR programme is part of that work. LeDeR is continuing to look into what has happened when someone with a learning disability dies, to make sure that no mistakes were made. Every area has a steering group set up to do this work. When everything has been done correctly, this does not take very long, but if there is any sign that mistakes were made, then there is a more in-depth review. All of this work aims to make services better for people with learning disabilities. The government, through NHS England, is committed to learning lessons and involving people with learning disabilities, their family and carers. It is difficult work, but we can hear why people get involved.
At first, I was quite reluctant to take part in this because my own son died 3 years ago. And it's still hard to talk about it. And when the opportunity arose for me to take part in some small way in everybody learning from a process of looking how other people's children, mothers, fathers, sisters had died, and for that learning to be shared across the whole of the country was really an opportunity I couldn't turn down. And even though I still find it difficult, I am determined that we will learn, and I see it as my role on this meeting that I represent families, to be a strong voice. It's a positive process. And I'm looking at it now with excitement to be able to say, yes, we did that, we learned from it, and these are the results. And I hate statistics, but I'd love to see these statistics fall.
I'm Joanne Greenwood, and I'm leading on implementing the LeDeR programme in Lancashire. My background is I'm a mental health nurse, and I also provided some professional nurse leadership around the learning disabilities agenda, and that's why I was delighted to have been asked to be part of rolling out the LeDeR programme in Lancashire. The reason why I'm passionate about this programme is because the people with learning disabilities are some of the most vulnerable people in our society. And I think it's the right thing to do, and it's the right time to start to understand why might those people be dying earlier than people without learning disabilities. It's a fantastic experience in Lancashire to work with experts by experience, carers, commissioners from health and from social care. With Health Watch, a whole range of key people are contributing to the programme to make it a success, and we're all looking forward to the outcomes.
My name's Meg Davey. I'm the Assistant Director for Patient Experience from East Lancs Hospitals Trust. We know from national pieces of work that patients or people with a learning disability sometimes die much younger than they might have done without the learning disability, and this LeDeR project in this area enhances the work that we're already doing. This is a national scheme so that from this learning will be shared on a national scale, and that needs to happen to support the research and the good work that's happened to highlight the concerns about learning disability deaths.
Anyone can tell the LeDeR programme that someone with learning disabilities has died. You can report it using our website. You can phone us on our private phone number 0300 777 4774.